You know, it's rarely I do an interview on the Pet Show because your questions and comments are always the important thing for me. However, I wanted to introduce you to a friend of mine, someone I've known for many years, Dr. Alan Schumann, who, by the way, operates the Animal Medical Center of Southern California and also the Veterinary Surgical Referral Service, a state-of-the-art veterinary medical, surgical, and emergency facility located on Sepulveda Boulevard right here in West Los Angeles. Let me get him right on the phone. Dr. Schulman, you with me? Okay. Well, he'll be with me in a second, I promise. We're going to talk to Dr. Schulman. We're going to find out a little bit more about... Oh, there he is. Dr. Schulman, you with me?
Hi, how are you doing today?
I am doing fine. How are you doing? I'm so glad and so excited that you're joining me today, especially talking about this topic.
Oh, my pleasure. And please, thank you so much for inviting me on and letting me share some of my knowledge and insight.
You know, for so many years, and, you know, I've known you for many years, and for years I've been talking about aggressive behavior, and I've had vets say that it was impossible and there was not a medical reason, or a dog goes into a shelter and he's euthanized because they don't have him checked by a vet. So I felt it would be really, really important, because so many of my listeners are into rescue. I felt it would be really, really important to spend some time with you talking about the medical causes of aggression in dogs. You know, I deal with the psychological aggression in dogs, which very often is easy to resolve, but it's not always so easy if there's a medical reason behind it. So can you talk a little bit about some of the medical issues that a dog or cat may have that could cause them to be a little bit more aggressive, and how sometimes the normally playful dog or cat all of a sudden becomes aggressive for no reason that we know, but there is a medical reason for it?
Oh, look, absolutely. It's a huge subject area, and you know, I would say that obviously there are a tremendous number of conditions that can cause unusual or aggressive behavior in dogs, and you know, at the onset of any sign of aggressiveness or change in behavior patterns, all possible medical causes should be ruled out before you consult with somebody like yourself, because there are so many medical reasons that can cause a dog's mood swings or aggression. And if that's the case, no amount of training is going to be effective until that problem has been resolved or controlled.
You know, I'm so glad you said that, Dr. Schulman, because over the years, you know, I've been doing this for a few weeks, but over the years, it absolutely amazes me how some behaviorists, when they notice all of a sudden aggressive behavior in a dog or a cat, won't refer the person to the vet. And very often I've seen the other way, where a veterinarian would not refer to work with a behaviorist. And I think it's so important, even if the causes, and I may be wrong, and help me out on this, even if the cause of the aggressive behavior begins as a medical reason, once the medical reason is worked with a veterinarian like yourself, then a combination of medical and behavioral should probably be the best approach to resolve it.
Without a doubt. We have to work as a team together. No one person is going to solve all the problems in every one instance. And so, you know, there should not be any hesitancy on the veterinary side to go ahead, do what you could do as a medical professional, but then also seek the advice of behaviorists and trainers appropriately, and work together in order to get this dog or cat back to being its normal self.
You know, no one has more respect for veterinarians than I do. I've been working with veterinarians pretty much my entire career. I had a call last week. It was an interesting call. It was someone who had a 5.5-year-old German short-hair pointer. And all of a sudden, the dog was, you don't see too many of those anymore, but all of a sudden, the dog, who was a great dog, became a little aggressive. And they took the dog to their local veterinarian right here in Southern California, and the veterinarian said, well, the dog's aggressive. I would not keep him at this point. What?
That's insane. Listen,
thank you.
It is such a gigantic subject area. I don't even know where to start. Let me start first just by saying, you know, one of the more common things that at least we see, aggressive behavior because of pain. And there are so many different sorts of painful things that will cause dogs to become aggressive. You know, if for myself, as much general practice as I do, as a orthopedic, neuro, and reconstructive surgeon, we see so many dogs that come into us because of joint pain or bone pain, whether it's from cancer, infection, immune-mediated causes, degenerative arthritis from aging. All of that's going to affect them. Other tumors in other parts of the body. Listen, it's going to affect people. You're just not going to be yourself. So if your dog has any sort of cancerous process, that could be causing, pain responses and aggressive changes in behavior.
It's funny you said that, because I often say to my wife Denise, I say I have rheumatoid arthritis. So there are days that every part of my body hurts, and I might be a little aggressive, assertive. But thank God for Denise, she'll point it out. So lots of times there's chronic or intense pain, whether it be arthritis or some of the other things that's actually causing the aggressive behavior, and yet for some reason people are not putting their finger on it. I don't get it.
No, they're not. It could be as straightforward also of significant abdominal discomfort from gastroenteritis. They swallowed a foreign body you didn't know about. They ate something that they shouldn't have, and it's bothering them and giving them, gas, discomfort, diarrhea, nauseousness, dental pain, bad teeth. We see that all the time. And of course, pain from general trauma, a physical injury, being hit by a car, falling from a height. All of those things easily can cause enough pain or discomfort to turn a dog, to show aggressive symptoms.
But what about those things we can't see? What about things like brain chemistry, or low thyroid, or low calcium, or low glucose?
Listen, without a doubt, looking at primary brain-related issues, again, brain tumors, certainly, infection, whether it's bacterial or viral, tick-related, fungal-induced, all of these sorts of infectious agents can have deleterious effects on the dog's cognitive function and how he's going to perceive things and potentially make them aggressive. There are multiple different reasons why dogs can get encephalitis or meningitis. Sometimes you have hydrocephalus or water on the brain in certain breeds that are going to, taint their perceptions and potentially make them aggressive for no reasons. We see things, the fancy term is cerebral occipital malformation syndrome, where the way the spinal cord comes out of the brain, it's just not shaped properly. And the more proximal or rostral portions of the spinal cord are malformed. And all of this gives pain and discomfort that you're never going to see it until all of a sudden it starts becoming a significant issue and the dog's going to become that much more aggressive. And you're going to need a veterinarian to perform regular survey radiographs to try to detect some of these things, and probably MRI or CT advanced imaging techniques as well, in order to be able to give you an accurate diagnosis.
Let me do this, Dr. Let me take a quick break. I want to come back and I want to talk to you about, I'm a New Yorker, not because of my accent, of course. But when I was working many years ago in the late 70s, I was doing a lot of work with the Animal Medical Center. You remember William Kay, the head of there? I knew him well. Anyway, when I did a lot of their behavior work, there was something going around called Springer Rage. Do you remember that?
Oh, without a doubt.
So Springer Rage, and now I'm hearing, so Springer Rage, everyone was thinking it was breeding, but now there seems to be a seizure affects the brain's portions that causes the hypothalamus and limbic. You'll know more. Let me take a quick break. Let's come back, talk a little bit about that. Let me put you on hold. A quick break, then right back to Dr. Alan Schumann, one of the most intelligent veterinarians I know. I've known Dr. Schumann for years. As I say, he's at the Animal Medical Center of Southern California on Sepulveda on West LA, and he doesn't know yet, but I plan to have him on from time to time talking about veterinary issues. A quick break, then right back at you. I'm Warren Eckstein. This is The Pet Show. Come on, you know I got the best music out there. We are back on the Pet Show. We're talking to Dr. Alan Schumann from the Animal Medical Center of Southern California, my friend, and also just an incredible veterinarian and surgeon. Dr. Schulman, Springer rage. In the 70s, it was the big thing. Springer, I was also with Akitas. There was a store that opened up in New York called Akitas of Distinction. So I was getting the Akita rage and the Springer rage. And people were just inundating the shelters with them. But there's actually, from what I'm reading, a portion responsible of the brain called the hypothalamus and the limbic system. Is there something that can be done for that?
Well, there is. How effective it's going to be is going to vary among each dog, just like it would in people. But we know that these rage syndromes, I see it most commonly now in older Cocker Spaniels. So I joke about them, being an Alta Cocker that comes on in here and, has these rage syndromes from absolutely out of nowhere as they age. A lot of it does affect the limbic system and the hypothalamus, as you mentioned. And the thought processes are that you could have various alterations in serotonin levels, either in the actual level of this neurotransmitter or at the receptor sites in the brain. And, there are what are called selective serotonin uptake inhibitors, medications that could be used. Some of these rage syndromes, or if I could call them petit mal seizure type effects, also happen in older dogs because of normal aging changes and dementia or cognitive change or senility. And so that's why it can be so variable as to how effectively you're going to be able to go ahead and to treat. It makes it difficult, but there certainly are. This is a true inherent organic brain issue that gives you this sort of a behavioral pattern. It is a medical reason and cause for dogs having aggressiveness tendencies.
Over the years, doing the radio show and, this radio show and the radio show I do right after this, it's interesting how many times where aggressive behavior, people have called me up with the dog they've had for 3 or 4 years, and all of a sudden it has whatever aggressive behavior it has. It could be a big dog, could be a small dog, could be a medium dog. And very often I'll say, have you spoken to your vet about a low thyroid? And all I said, no, I've been taking the dog to the vet. I've been asking the vet about the aggressive behavior, and not once did the word thyroid come up. So I suggested to some of these people, and my background's behavior, it's not in veterinary medicine. I suggested, well, have a conversation with your vet, ask him about the thyroid, and see what the levels are and see what he may want to do. And almost in every single case I've dealt with, once the thyroid was back to normal, the aggressive behavior disappeared. Why is it so difficult for some vets to say, you know what, let me go a little bit more to detect maybe a medical reason for the aggressive behavior?
That's a great question, because I don't have a problem searching. I mean, most of the time, if a person is going to come into me with that sort of a description, you get a minimum database where you run a complete blood test and urinalysis and just some regular survey radiographs to see, are there any obvious tumors? Are there any obvious metabolic abnormalities? You're absolutely correct. We see it with hypothyroid dogs. We see it incredibly with hyperthyroid cats. Other than the thyroid axis, you could have hypoglycemia or low blood sugar caused by what's called an insulinoma, a certain tumor of the pancreas. And if your glucose levels are off, you're whacked. Yeah. We also see, commonly as a cause of metabolic disease causing behavioral changes, any one of a number of different types of changes to your adrenal gland function. You could have overfunctioning adrenal glands called Cushing syndrome, underfunctioning adrenals called Addison's syndrome. You could even have adrenal tumors, and the fancy term is called a pheochromocytoma, where you're secreting too much epinephrine. Well, if you're that metabolically, fried, absolutely, it's going to affect your behavior.
I don't want to run out of time. You have to promise you're going to come on with me again, right?
Sure.
But I just want to get your final thought after. This is something I wrote, my conclusion. Sadly, every year, thousands of dogs end up abandoned or in shelters due to aggressive behavior. Before giving up on your dog, make sure a medical condition is not the culprit for the aggressiveness. Many of the aggressive causing medical conditions can be successfully treated or at least managed, just what you said. In a nutshell, before making a decision, have your trusted vet perform a thorough examination on your pet. That would be great advice for anyone, wouldn't it?
Oh, without a doubt. And listen, so many of your listeners, they take care of their animals so phenomenally. Lastly, I would say sometimes the reason why you see these sorts of behavioral changes is because they've allowed their dogs to live that long, given the excellent care that they've been administering, that it's just part of the aging process where something as simple as the loss of some sight or the loss of hearing or just loss of stamina. And, they can't keep up. They don't perceive their environment the same way that they were before. And it's all basically because of some aging changes.
Yeah, it's just amazing. There's so much more I want to cover on this. I'm going to have you on for a lot of different subjects, but there's so much more. But I'm so glad that my listeners had the opportunity to hear directly from a veterinarian that if in fact their dog or cat is all of a sudden displaying aggressive or assertive behavior, the first conversation they should have is with their veterinarian. And if the vet decides that it's something that should be worked on together with a behaviorist, that's when they call someone like myself. Dr. Schulman, let me just thank you for coming on. If people want to get in touch with Dr. Schulman, as I said, he owns and operates the Animal Medical Center of Southern California and the Veterinary Surgical Referral Service. Let me tell you, it's a state-of-the-art place. I got to give you a face. It's on West Sepulveda Boulevard in West Los Angeles. You have a website, Dr. Schulman?
Yes, it's called animalmedcenter.com.
Animalmedcenter.com. So you promise you're going to join me again?
Absolutely.
But the next time we'll have another dinner first. How's that?
How's that? That sounds fantastic. Looking forward to it.
Dr. Schulman, thank you so much. I'm telling you, thank you so much for joining me. What an incredible conversation. So there you have it. It's not just behavioral reasons. There are psychological reasons and medical reasons as well. Quick break, then right back at you on Warren Eckstein.